Good evening, ladies and gentlemen. On behalf of Nurses Across the Borders, the World Health Organization, the Federal Ministry of Health Nigeria, and the Delta State Government of Nigeria, it's my pleasure to welcome each and every one of you here to this side event being put together as part of our mitigation strategies as far as climate change and health is concerned. The theme of our side event today is the health implications of climate change and mitigation strategies. Before I announce the speakers of this event, it is my pleasure to let you know that today's event is very, very key in the sense that a lot has been said about adaptation, a lot has been said about climate financing, a lot has been said about smart cities, but very little is being said about empowering those who are supposed to form the forefront at the defense on climate change and its hazards. Tonight, I have on our panel distinguished members from the government services and from the civil society. I want to start by introducing the Commissioner for Health, Lagos State, and he is Professor Akinola Abayomi. You're welcome, sir. Lagos State is one of the few states in Nigeria that are taking great strides in promoting climate change and health resilience and mitigation strategies. Following that, I also want to introduce to us here tonight the Permanent Secretary, Delta State Minister of Environment. She is Mrs. Dr. M.I. Oseji. You're welcome, madam. Just directly by the side of Dr. Oseji, we have a two-time mayor from Lagos State in one of the riverine states in the Federation, and his name is Honorable Adetola Ganiu. He was a two-time mayor of Ikosejiri, local government in Ekpe local government in Lagos State. You're welcome, Honorable. And to strengthen our partnership between the Global South and the Global North, we also have a partner from the United States of America, and that is Dr. Katie Hoofling. Dr. Katie is the Executive Director of Alliance of Nurses for Healthy Environment. You're welcome, madam. And last but not the least, we have Dr. Oma Perpetua Ofodile. She's the Deputy Director of Marine Environment and the Head of Climate Department of the Nigerian Marine Administration and Safety Agency in Nigeria. So they are in charge of the marine water. So it's a coalition of all experts that matter in trying to build mitigation strategies against climate change. Representing the WHO, who will soon join us, is Dr. Brahma Kone. He is the technical officer of the WHO Climate Change Unit. And so we are waiting for him. I understood this at another event. He will join us. Ladies and gentlemen, before we begin this discussion, I have very few facts to put before you. I call it my reality check. These are facts and not fiction. The reality of the climate change crisis and public health. Disaster risk is magnified by climate change. it can increase the hazards while at the same time decreasing the resilience of households and community. That's a fact. Every second, according to the Norwegian Refugee Council, every second, one person is displaced by disaster, making 60 persons per minute, 3,600 per hour, 86,400 persons per day, and 2,592,000 per month, with 31,104,000 per year. As we speak, we're going to be here for 75 minutes. So you multiply one person per second times 60, then times 75 minutes. That will tell you the number of people that are currently being displaced by disasters. That's a fact. Every year, the tobacco industry costs the world more than 8 million human lives, 600 million trees, 200,000 hectares of land, 22 billions of water, and 84 million tons of carbon dioxide. That was the WHO report May this year. The majority of tobacco is grown in low and middle income countries, where water and farmland are often desperately needed to produce food for the region. Instead, they are being reused to grow daily tobacco plants, while more and more land is being cleared for forest. Tobacco products are the most littered item on the planet, containing over several thousand toxic chemicals, which leach into our environment when discarded. Roughly 4.5 trillion cigarette filters pollute our oceans, rivers, city sidewalks, parks, soil, and beaches every year, according to the WHO. Now, for those of us who have been in Egypt, you will discover that cigarette smoking is, I'm not condemning them, but there is just no way you can run from the effect of the cigarette smoke, even when you are in the public transport. These are reality facts. Drought. The number of people suffering extreme drought across the world could double in less than 80 years, which has major implications for the livelihoods of the rural poor and can also lead to increased migration streams. There will likely be a large reduction in natural and water storage in 2/3 of the world, especially in southern hemisphere. Sea level coastal flooding events could threaten access of up to 20% of the global GDP by year 2100. The population of coastal areas has grown faster than the overall increase in global population. Infectious disease. By 2050, mosquitoes that carry vector-borne diseases like malaria could reach an estimated 500 million people. Global warming has led to a loss in biodiversity, resulting in increased transmission and incidence of the disease. Due to altered climate patterns, urbanization and deforestation, bats and rodents, which are responsible for 60% of the diseases transmitted from animals to humans, have flourished. Wildfires by 2030 could be 3 months longer in areas already exposed to wildfires. In Western Australia, for example, this will add up to 3 months of days with high wildfire potential. Why then are we here? We're here just to be a bit biblical with respect to everyone's religious belief here. There is a story of Noah and the ark in the Bible. The flood in the Bible did not come to humanity by accident. God warned humanity about the coming flood. Because God believed in resilience and preparedness, God asked man to prepare for the coming flood. Those who believed and got prepared were saved. That was Noah and his entire family. But those who refused to heed to the warning were perished by the flood. Exactly what is happening today. You and I were here in this conference drawing attention to the implications of climate change to humanity. But there is one thing that is missing. Humanity is not taking this campaign seriously. Why? Because they are neglecting the very critical section of this campaign that are responsible for building and adapting to the effect of climate change. That is the health ministry and the healthcare professionals and the healthcare providers. That is why today we have brought a lot of us together here this afternoon to discuss. Our interest is to see how we can build collaboration. A lot of prescriptions have been given to us externally, but we do not want prescriptions as solutions to our problems. We want to be part of the solutions. And we can only do that if we collaborate, and every expertise and funding that can be generated is brought to Africa that contribute less than 4% of the global emission, but yet we suffer more of the impact in our health and even in the degradation of the land and humanity. And so that is why this afternoon we have the caliber of speaker that was speaking here tonight is going to address this issue of the health implication of climate change and the mitigation strategies. And so, ladies and gentlemen, Noise Across the Borders has been at the forefront of this campaign since 2004. The reason why we joined the UNFCCC was because health was missing. When we asked why did we want to join the UNFCCC, we said we want to promote the campaign for health and climate change. And that is why we're here. In 2009, 2010, we were among the WHO group that began the campaign to adding health discussions in policies and the climate change discourse. So without much ado, I want to start off this discussion by inviting to the podium who will be our first speaker today, and that is Dr. Professor Abayomi, who is the Commissioner for Health of Lagos State. We were very impressed because of the stride of what Lagos is doing in terms of climate change and health. And we are very honored to have him here. Dr. Abayomi was speaking on how can the government collaborate with the civil society in building an effective mitigation strategies against the climate change crisis. Professor, you have the floor, sir.
Good evening, everybody, and thank you very much for inviting me to speak at this session, and I'm particularly intrigued by the title of this side event. So those of you that don't know me, I work for government. I work for the Lagos State government. The Lagos State is one of the states in Nigeria. It's a coastal state. It is famous for being the mega city of Africa. It has a population of about 30 million people on a very small footprint on a coastal piece of land. It has about a third of its size is water, lagoons, rivers, and the seafront. Because of its population and because of its size, it's a very heavily dense human footprint, and that makes it extremely vulnerable to climatic shocks and to other biological events. So, for example, COVID spread like wildfire through Lagos throughout our 5 waves, because everybody is in very close proximity. So we're very, very nervous about climate change because we're coastal, we're low-lying, the sea is rising. Literally, you can see the sea rising every year. We've got 8 big rivers flowing into Lagos, bringing a lot of fresh water. Because the north of Nigeria is drying out, we have a lot of inbound migrants, coming to the center of commercial activity. So we have an inbound movement of people. You can imagine how much it takes to feed 30 million people. Can I get some water, please? Sorry, I've been talking all day, so my voice is getting a bit rough. Is this the loudest microphone you have? It's closer to my mouth. Okay, right. So we've got people problem, we've got density problem, we've got water sea problem, we've got flooding problem, we've got heat problem. So we're not going to sit down as a state that has lots of vulnerabilities to a shock, an environmental shock, and wait for these events to happen. So the topic of what you've asked me to speak around is how do we collaborate with civil society? Now, as soon as I took office, which was about 4 years ago, the first non-government person that I appointed was a high-ranking member of the civil society. And I established a civil society desk. Thank you very much. So we established a civil society desk inside the Ministry of Health. I mean, that's a very unusual thing to do. But we know that if you really want to have impact, you have to make civil society your best friend. A lot of government are always fighting with civil society because civil society are always pointing out their shortcomings and pointing out their gaps and pointing out their failures. Well, there's nothing wrong with that, you know. The best thing to do is to bring them in on your side so that when they point out your shortcomings, it's not so painful because you've heard it before. So we have a civil society desk, and what that does for us is, as government, because government is often quite displaced from the people, you know, so it gives you a voice of the people really right down at grassroots community, you know, where things are actually happening. And you're sitting in this little ivory tower, you're very far away from the people, you know, you actually make laws and policies, some of which are irrelevant. They have no consequences on community. So if you have a good, strong civil society organization inside your ministry, you get this information, it's fresh, it's real time, it's relevant, and that helps you to define your policies, your laws, your programs, and your projects. So your projects now become relevant. You develop your budget to implement your projects. Civil society come in again to give you an idea of how effective you've been implementing your projects. Because, you know, as a commissioner of health, which is my post, I can't be in the field monitoring what's happening. And the people that work for me may or may not give me the real picture of the reality. So I need ears and eyes at the community level. And civil society, they don't lie. They tell you the hard truth. You may not like to hear it, but they give it to you real, all right? And if you establish that relationship where, first of all, you're getting the information about what to do, for example, in climate change, you may not realize that people in the community, their wells are being salinated, you know, and when they're drawing their water from the well, it's really difficult for them to use the water. You know, you may not know about it. All you know is that you have 500 wells in this community, but you don't know that out of those 500 wells, 95% are not providing good enough water, you know. So you now need a plan to either take those wells deeper or put in a purification plant on the water so that the water that's coming out of the wells is useful for human beings. I'm just giving you a simple example that, you know, what you see from your high position in government is quite often, you know, clouded from the reality, you know. So you need civil society, and I love the way civil society operate. They're very networked, you know, and if you want information, intelligence about what's going on, civil society. If you want to implement projects, civil society. If you want to monitor your project, civil society. At the end of the day, if you're really a government that wants to have impact, then you really need to have a very strong civil society organization working along with you. Now, you don't want a group of civil society people that say things to you that you want to hear. That's not what you want. And you can quickly pick out when that is happening. What you really want to hear is the voice of the people at the grassroots level, because they are your main and your most important constituency. And you really want to, as a government, you want to have impact at that grassroots level. And so you want a truthful set of civil society operatives giving you that information, and you're operating through them to deliver. Now, for something like climate change, I mean, you just need to walk through these corridors, and I'm sure that 70% of the people at COP are civil society. You can tell civil society people, you know, they look different, they talk different, they're fairly aggressive, you know, and because they have a constituency and they're fighting for their constituency and they don't have time to waste, you know. So when you meet them, they give it to you, boom, 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 and you know, you've got to listen, you know. So if you want to be effective at a place like this, you really have to come along with civil society, and they'll take you to where you need to be. They'll take you to where you need to hear what you need to hear, and they'll take you to where you can actually get help for your programs in Nigeria. Before I finish, I just want to introduce my top civil society person in my office. She's sitting right there. Her name is Titi. Can you stand up? Titi keeps me on my feet. She keeps me informed. She keeps me monitored to make sure that as government we're delivering impact. So that's the way we collaborate with civil society. Thank you very much.
Thank you very much, Honorable Commissioner. Yes, it was the handwork of Titi that made it possible for you to be at this event. So that is networking. Thank you very much, Titi. Please, a hand of applause to the Commissioner for Health. Now, leaving Lagos, we want to move to the US, and I have Dr. Hufling here to talk on the global North and South collaboration, what way to build the capacity of health care professionals in mitigating climate change impact on public health. You have the floor, 5 minutes. Thank you.
Thank you. Thank you so much for inviting us to be a part of this here today. We're really happy to have, I think, the largest group of nurses ever at a COP. I've met more nurses here than ever, so this has been really amazing to have the nursing voice well represented. And it's vitally important that nurses are at the table. We're the largest portion of the healthcare workforce. There's over 28 million of us around the world. We're about 53% of the healthcare workforce. And so it's critical that nurses are engaged in these discussions, and we're solutions people. So we always say you can't get things done without nurses, and I feel it's the same with the climate crisis. But unfortunately, there's still a lot of hierarchies in healthcare. And so I feel like nurses really haven't been tapped to their fullest potentials. And as Pastor Peters and I have been discussing how the Global North and Global South can be working more collaboratively together, I feel like nurses could be a really lovely test case of how we can be making a positive impact on health. And nurses are just so primed right now to be engaging in this work. Just as an example, my organization, the Alliance of Nurses for Healthy Environments, has partnered with another healthcare organization, Healthcare Without Harm, for something called the Nurses Climate Challenge, where we've been educating nurses and then having them educate their peers. And we had a goal of educating 50,000 nurses before the end of 2022, and we just passed the 50,000 mark. Yeah, so we want to take this global. We think that there's just such an interest and passion in nurses as soon as they're educated around the health impacts of climate change. And thinking about the discussions that Pastor Peters and I have had, just last year in the British Medical Journal, some colleagues of mine had a really fabulous article published called Nursing's Pivotal Role in Global Climate Action. And they have 5 kind of buckets of how to make change within nursing to really build the nursing leadership that we know there's that potential for. The first is to accelerate change by leapfrogging nurses into leadership roles. We should be a part of executive teams, no matter where we are in the world. That we need to have nurses on international and national boards, Congress's government panels, like as part of civil society groups. Having nurses engaged through them, I think is very critical. And building partnerships among nursing organizations around the world, working together on climate action. And we need to amplify leadership and sustainable healthcare initiatives, both in the workplace and in our communities. Nurses are in every community, and when we're able to amplify the incredible work that's going on, it just builds exponentially. We need to pay nurses for their climate change work. We need to give nurses and nursing students the skills they need to create the future. I just love that. Being in the climate change space for a little while, we're always like, it's the greatest public health threat we face today, but it's also the greatest opportunity. And we can have such an immense positive impact on the lives of our communities when we address climate change. That we need to integrate planetary health, social determinants of health, health equity, and lifespan and occupational and location-specific vulnerabilities into nursing climate change education. I also love this one because I'm an activist at heart. Rekindle activism, advocacy, and relentless truth-telling. We need to amplify the voices of nurses to reach healthcare professionals, patients, families, and our communities. And we can extend the effectiveness of nursing by speaking truth to power to mitigate the effect of climate change on health. We need to ensure a global lens by extinguishing Western biases in the climate action agenda of nursing. We need to promote a stronger voice from nurses in low and middle income countries in the international climate action agenda. And we need to adopt successful climate change strategies developed in low and middle income countries as models for other countries across the globe. And finally, we need to put equity, justice, and morality front and center. Nurses, I think this is where our voices can be incredibly powerful. We need to call for health equity agendas to be central to climate actions, and we have to aim to achieve the Sustainable Development Goals for all nations. I think if we put health at the center and have nurses at the table working together collaboratively across the world, we can make incredible change. And one last pitch for this is we need funding to do that. We need funding for nursing education around climate change and really funding to help put nurses in all these communities, put nurses at the table. And we need our governments and foundations to be funding this vital type of nursing work. Thank you.
Thank you very much, Dr. Katie, for that insightful input. We're going to have a robust discussion after the sessions. So I want to move on to our next speaker. She is also a government person. I think we count ourselves lucky that we have two key ministries that are involved in the climate change campaign, represented at the level of governance from Nigeria on this panel. And so, ladies and gentlemen, it's my pleasure to introduce Dr. Oseji, who is the Permanent Secretary of the Ministry of Environment in Delta State. She's going to talk to us on the Niger Delta ecological disaster. What role for the health care professionals in mitigating the health impact? You have the floor, Madam. Please put the microphone to your mouth.
Hello. Good evening, everyone. It's indeed a pleasure to be here on this distinguished panel to talk about the Niger Delta ecological disaster. What role for the healthcare professional in mitigating the health impact? I'll start by giving one definition of disaster. It's an occurrence that causes damage, economic disruption, loss of human life, a deterioration in health and health services on a scale sufficient to warrant an extraordinary response from outside the affected community or area. Furthermore, it gives rise to what we know as internally displaced persons, IDP. That's someone who is forced to leave their home but who remains within their country's borders. So one of the major disasters we have experienced in recent times is the disaster of flooding. And my state, Delta State, has experienced series of these phenomena. I have in-depth knowledge about these things because even though I'm currently the Permanent Secretary of Delta State Ministry of Environment. I'm a medical doctor, a consultant, public health and community physician, and I was Permanent Secretary, Ministry of Health for 4 years and 4 months before being posted to Environment. And so I was very much involved, first as a director in 2012, then as a Permanent Secretary in 2018, 2019. There was flood in 2020, but because of COVID, the response was not as great as it was before. And then I used those experiences to support the response in the 2022 flood, which we had. The 2012 flood was before now the worst of its kind. We hadn't seen anything like that for like 50 or 60 years, we were told. But the one of 2022 was even worse than the one of 2012, because you could see the level of submerging of houses, whereas in the previous times you had houses being submerged to the middle of the heights, but this time they were being submerged up to the rooftops, so it was terribly bad. Now, what are the impacts, health impacts of such disasters? First, you can have mortality and injuries, which place a great burden on the affected community. Increased risk of spread of communicable diseases and environmental hazards, respiratory diseases, person-to-person infections, waterborne diseases like cholera. Disruption of the provision of routine health services, including preventive services such as family planning, antenatal care. Psychological disorders, you may have people coming down with anxiety, depression, temporary confusion, disorientation. Disruption of normal socioeconomic activities that could lead to drug abuse, alcoholism, destitution. Food shortage with the attendant consequences varying from malnutrition, starvation, with the women and children being more vulnerable. And then you could also have increase in diseases that have otherwise been endemic, and then casualties occur at time and place of impact. Assuming you have people that have suffered drowning, they have to be rescued, taken to the hospitals to go and have resuscitation. Now, what are the roles that healthcare professionals can display at a time like this? First of all, before the disaster management has 5 phases. I won't go into those details because of time. But the pre-disaster phase, before the disaster occurs, there's a lot of advocacy on climate change, mitigation and adaptation that needs to be done. Advocacy for better houses. Many of our residents, particularly those that are of low income, they live in shanties and settlements and camps. And those camps are the first to go whenever we have such disasters. So we need to start advocating for better housing as well as climate change. And then, when the disaster occurs, there are specific responses. I've mentioned the internally displaced persons. Usually we set up camps for them. And these camps will have clinics. And the clinics will provide routine health services, immunization, and so on. Now, you also need to ensure that those camps are sanitary. So the environmental health workers will go around, members of the health team, fumigate those camps, make sure that they are clean, make sure that they have proper toilet facilities and adequate water facilities. Then you make sure that there is provision of food, and you mobilize the disease surveillance notification officers for active surveillance and public health education to prevent outbreaks. You work with non-governmental organizations as well as professional health associations. I'm very happy with the comment on civil society, and I have continued to advocate that professional health associations should take a cue. So we have the Nigerian Medical Association, the Medical Women's Association of Nigeria, the Federation of Local Government Nurses, the Nigerian National Association of Nigerian Nurses and Midwives, and so on and so forth. They can all come together to make their own contribution to the response. And then you have to continue to monitor the sanitary situation in the internally displaced camps. And then I'll go on to round up by talking about when the disaster is over, what we call the rehabilitation phase. You have to encourage the residents to fumigate those homes that they have evacuated, because there'll be rodents, reptiles, and so on, so that they don't go back to homes and start falling down with diseases, coming down with diseases. And then you have to advocate for reconstruction and renovation of health facilities that have been destroyed by such disasters. Thank you. Sorry about my voice.
Thank you very much, madam. Now you all agree that nurses play a critical role, and healthcare professionals within the health system were the first line of defense during the COVID-19 pandemic. Now, we cannot quantify the number of nurses, doctors, and other healthcare workers that died during COVID-19. But you discover that most of the countries that you had this crisis more, if you look at their climatic condition, it also exacerbated the spread of the COVID. So, and that is why it brought a lot of work on the health institutions and the workers. That is why you find a lot of healthcare workers falling down sick and a lot of them breaking down, and which is why this is key. So I want to thank Dr. Oseji for our interventions, and we'd love to move on to another very mostly unspoken area of the healthcare discourse, and that has to do with ocean. Now, ocean as a source of sustainability, putting Nigerian maritime efforts towards achieving climate health. And to talk to us about that is Dr. Omar Perpetua Ofodile, the Deputy Director of Marine Environment Management and Head of Climate Change Department. You have the floor, ma'am.
Good evening, Dr. Peters and the panel members. Good evening, everyone present here. Thank you. We are happy to be here. I'm here with my team, the Nigerian Maritime Administration and Safety Agency, and we are happy to be given this opportunity to bring to the fore what the agency is doing as regards ocean health and also maintaining a clean marine environment. I am not going to start dwelling on what ocean is. It's already a wide knowledge. The world, about 90%, is covered by sea. And that goes a long way to show how important it is to human existence. And at the beginning of this session, the moderator had gone in depth to tell us about the importance of ocean and why ocean should be considered a priority on this issue of greenhouse gas emission reduction. Having said that, I just want to chip in that there are countless benefits that we get from the ocean. It is known by research and fact that ocean provides at least half of the oxygen we breathe in as human beings on Earth. The ocean also absorbs 50 times the carbon dioxide that is being emitted into the atmosphere, that is also causing these global changes that are so worrisome now on different perspectives. We also know that the ocean businesses provide countless jobs, especially to developing countries. About 170 million, as recorded by research, jobs on fisheries are being provided by ocean. We also know that about the 60% of the dietary protein we consume as human beings come from the ocean. And all these put together, among so many others, gives us the wide knowledge of how important the ocean is to us. And of course, when it comes to trade, 90% of the world trade is carried by sea. And that is where we come into. The Nigerian Maritime Administration and Safety Agency is in charge of ensuring that we have a healthy ocean, safe, secure shipping, and of course, clean marine environment. And what we do, we don't do in isolation. We are a member state of the International Maritime Organization. And whatever we do as a nation under maritime affairs, we align our activities with the IMO. And the IMO also has been given mandate by the UNFCCC to ensure that international shipping and maritime reduces its carbon footprint. And that is exactly what we are also doing as an agency in our own country. When it comes to ocean and health, NIMASA has been doing quite a lot. People always say, what does shipping or the industry have to do with health, with greenhouse gas? Initially, it was even difficult to understand our relevance on this issue. But being here this night has also opened our eyes to the fact that the efforts towards reducing emission from the globe is interwoven. No one sector can work in isolation. Every activity that comes from any agency dovetails into the other. Likewise, that of the NIMASA. We know that vessels run on heavy fuel oil, and this heavy fuel oil have sulfur oxide as a major component. And of course, my colleagues, fellow panelists in health sector will tell you the effect of sulfur oxide on human beings. Sulfur oxide is one of the very dangerous gases that causes respiratory problems. And IMO recognizes this. That is why they have gone to enact several laws to minimize the quantity of sulfur we have in bunker fuel oils. And now, from about 3.8% sulfur in every heavy fuel oil, they have brought it down to 0.5, which means any vessel running locally or internationally must have the fuel oil with not more than 0.5 sulfur content in it. Let me get some water. And furthermore, there are also other aspects of health we are looking into. We know that now there is a serious call for marine litters. A lot of litters in the waters are also affecting the climate in different ways. When it comes to the garbage part of it, we know that methane is a gas that comes from garbage. When garbage ferments, it emits methane. Methane is another serious greenhouse gas, and the agency has been working very hard at ensuring that we carry out marine litter cleanup so that our ocean will be free of marine litters. So we do that annually just to maintain ocean health. Amongst that, we also, the NIMASA is also engaged in a seafarer development program. It's a support program where they give sponsorship for seafarers to go and study on different areas. Yes, it's been, grooming engineers, architects, and cadets for the vessels. But now, there is a futuristic outlook on health, how we can begin to also extend that opportunity to health workers, the doctors, the nurses, to be part of this issue. And also at the same time, we have a search and rescue clinic, and they work with the seafarers, and they also work to ensure that if there are accidents, sicknesses, diseases like during the COVID period, we have professional handy people to come in on maritime, from the maritime angle. And these are so many more. I could keep talking, but the 5 minutes given to me, Pastor has been looking at me, but not afford me more opportunity. I could go on and on and on to let this gathering know that the Nigerian Maritime Administration and Safety Agency, aligning its activity with the International Maritime Organization, has been doing a lot to ensure that the maritime industry reduces its carbon footprint, and at the same time recognize the importance of health and the health workers in our activities. Thank you.
Thank you very much. I'm sorry if I was looking at my time, but I didn't mean to be rude. But I can assure you, COP28 promises to be better and greater, because then we'll have a lot to do together as an agency and as an organization. And so there's somebody I want to introduce right now. He's going to join us virtually. He was the former designated Nigerian National Authority. That means he was the first national focal person on climate change, and the former technical advisor, African Union on climate change. He is the co-founder and vice president and group managing director of Greenplate Africa Limited. Ladies and gentlemen, I want to invite Dr. Victor Fudeke to take the podium. He is going to talk to us on tapping on available resources in building the capacities of healthcare professionals in mitigating climate change. Dr. Fudeke, sir, you have the floor.
Thank you very much, Pastor Peter Omorago. It's distinguished excellencies on this great occasion. It's a great pleasure to be with you virtually. And as you have rightly said, the lives of people who have already moved on as a result of COVID-19. May I kindly request distinguished excellencies on this program to observe a 1 minute silence by standing up on their behalf. Am I permitted to do that? Hello?
Yes, we are on. Yes.
Hello?
Yes, we are observing the 1 minute request, sir.
Thank you very much. May their soul rest in perfect peace.
Amen.
I want to put on record the excellent, indefatigable effort of Pastor Peter Omorago, who has unrelentlessly working to ensure that human health becomes an issue of the Conference of Parties. Before the world knew about this in 2014-2015, our organization signed an MOU with the Federal Minister of Health in Nigeria, and that agreement set the ball rolling throughout the whole world because Nigeria was the first. Now, within the minutes that you have given to me, it is very, very clear that the world is approaching what is called code red in terms of what is unfolding with the extreme weather phenomenon. I don't intend to speak much, but to put a proposal on the table for us. Following the success of COP21 in 2015 of the Paris Agreement, especially through the singular effort of former President Obama, that was a watershed event of the Paris Agreement. I wish to propose as follows. In collaboration with Nurses Across the Borders, Greenplate Africa hereby proposes to incentivize efforts towards global carbon management by proposing an international Hall of Fame on net zero carbon 2050, which will be unveiled in COP28 in Abu Dhabi, UAE, next year. That proposal will put to incentivize all efforts to ensure that private sectors that demonstrate in a race, that in a race, only very few people get to the end and they also get the reward. Such a proposal will have different sections to reward organizations that are involved, first of all, in enhancing the capability of the health institution to green the health institution by providing them clean energy. Now, it will be a record that will be noted that next year, COP28, International Hall of Fame will be unveiled, and during this period, there will be an International Board of Trustees that will be worked between the two organizations of Green Plains Africa Limited and Nurses Across the Border. And we believe that this will drive home of support that is needed, that before 2050, even before 2030, we can avert the negative consequences of this climate-induced disaster. Because what we are experiencing today is as a result of the emissions that were released 50 years ago. You can expect, just as what happened with the flood 10 years ago, which I was a victim when I was traveling after coming back from one of the meetings of the Compliance Committee Enforcement Branch. I had to leave. I wanted to travel from Lagos to Abuja. The airlines were on strike, so I had to come by road. When I reached Lokoja, I was told that it would take 3 days to cross a journey of 15 minutes. That was my experience 2012. Not knowing that this year was just, I can say, a grandmother of all the disasters, but we have seen nothing yet. And I believe that efforts by private sector, public sector, individuals, towards ensuring that it never happens again, and we work together through the establishment of the International Hall of Fame for Net Zero Carbon 50 will be a program to incentivize efforts of reaching this goal before 2030. Thank you very much.
Thank you very much, sir. Thank you very much, sir. Thank you for joining us all the way from Abuja. Our time is fast spent. I just want to quickly call on our last speaker before we have a 10 minutes interaction. And like I said, he was a two-time mayor of Ikoseji local government in Ekpel division of Lagos State. When we started our campaign on climate change, Ikoseji supported us across the borders, not just financially, but what they did, they also brought into the campaign, and we began a collaboration. And it is that collaboration, it is the story of that collaboration that Honorable Ganyu Aditola will be talking to us about. That is grassroots mobilization, the Ikoseji Local Government Council, and Nurse Across the Borders story. You have the floor, sir.
Thank you very much. Good evening, everyone. My name is Adetola Ganyu Olusegun. I served as the executive chairman of Ikoseji LCD, Ekpel local government in Lagos State, between 2008 and 2014 for 6 years. So since that time, the local council development area have been collaborating with nurses across the borders, and till now, the present executive chairman, Akogo Anomo, still join in collaborating with nurses across the border. So far, so good. The relationship between nurses across the border and the local government area have helped a lot. We're able to mobilize more people because the local government is the third tier of government and closer to the people, closer to the community. So that gives us opportunity to be able to relate with the people in the community. In fact, we're able to introduce them, and with the assistance of Lagos State government as well, tree planting campaign. If you cut off a tree, that means you have to plant 2-3 trees back, so that this will be able to lessen the negative effect on climate change. And then since that time, nurses across the border with the local government. I've been engaging in free health program. We provide free drugs, free blood pressure tests, and sugar level tests and all this stuff. So with that, the nurses across the border provide nurses and doctors assisting the people. So with this method, we're able to now convince as many people as possible to let them understand the climate change, to let them understand why they have to stop cutting forests, why they have to stop cutting trees, because they see it as a means of livelihood. They go into the forest, they cut trees, cut into pieces, and they sell. Sometimes they turn it to charcoal, and you see people still make use of the charcoal to cook, which is not even good for them. So with this, they don't really understand. So if we are here and we don't really go to the grassroots, that means we are not really communicating. We are not really passing the message. So with the assistance of the local government and the nurses across the border, we were able to reach out to the people in the community. And then since then, we've embarked on sensitization program, which have been helping. And quite numbers of people have really joined nurses across the border. So as I speak, we have over 100 people that are willing and having interest in working with nurses across the border to ensure that the message being really passed to the grassroots. So thank you.
Thank you very much, Honorable Adetola. If, because of time, but we'll plan for COP28. Distinguished gentlemen and ladies, you had different speakers spoke on different topics, but we all have one meeting point, which is the health of mankind. No matter the campaign, no matter the level of campaign on climate change, the only index to which you can measure the success of that campaign is the impact on your health and my health. And that is why this discourse is very key. That is why collaboration is very key. That is why we want to engage government. That's why we are very proud that yes, ministries of health like Lagos State Ministry of Health could engage the first civil servant in his ministry as a civil society person, which underscores the importance of engaging with civil society. But you also agree with me that there is a problem with most of the ministries at the federal level. For instance, the Federal Ministry of Health the Federal Ministry of Environment in Nigeria, to me, from my observation, have tend to monopolize the issue of climate change campaign. They do not, in all honesty, engage line ministries in the activities of climate change. Line ministries like health, agriculture, water, science and technology. These are line ministries and the maritime industries. But the issue is that the space for climate change activities is so wide that yes, one ministry cannot attend to it alone. That is why nurses across the borders are engaged in sensitization programs like this to draw the government's attention to account on the need that yes, there's a lot to be done on climate change and climate health. We need to build resilient climate health institutions that can withstand the impact of climate change. And so I want to open the floor for discussions and comments and questions for members of this panel. So we have just 5 minutes to do that. If you have one question, I can recognize you, Madam, number 1, number 2, 3. So just 1 minute, 4. 1 minute each for, yes, thank you very much. Introduce yourself and tell us where you're from. 1 minute, thank you very much.
Thank you. My name is Yeda Machage from Kenya. I work with the National Hospital Insurance Fund, recently rebranded Health Insurance Fund. NHIF is a primary driver selected by the government for Kenya for universal health coverage. So my question goes to Dr. Oseji, the Permanent Secretary. In the Sustainable Development Goals, The UHC now is measured by both the Service Coverage Index and the Financial Protection Index. I've heard you mention something on the implications of climate change on service coverage, but there seems to be, as I was sitting here, because I've been here the entire week, there seems to be a gap in maybe resulting also from climate change and its impacts on financial protection. Financial protection being impoverished expenditure, catastrophic expenditure, the number of people who are pushed lower with regards to poverty levels, and those who also experience high out-of-pocket expenditure. I am yet to tie climate change and the effects of it on financial protection. I would like to hear from you whether we have substantial studies on the same or your comments also on the same.
Thank you very much.
I thought they will ask all the questions.
Okay, fine. That is okay, fine. Please, yes, number 2. Yes, thank you very much. Yes.
Thank you. My name is Ahmed Abari from. I have a question. Hello. Hello. Okay. I have a question for Professor Akomi, the Honorable Commissioner of Health in Lagos State. Professor, it's a pleasure being in our mix today. We all recognize. Thank you. We all recognize and appreciate the good things you did to Lagos State and Nigeria during the COVID. You were all over the places trying to rescue lives. We are grateful for that. I want to ask this question. Giving us the initiative of bringing up the civil society decks into the governance for obvious reasons of policy development, implementation, and even execution. Could you initiate through the Nigerian Governors Forum, which I know is a peer review initiative, how this initiative can be institutionalized for adoption by government in other states? Because I know the issue of civil society has been of serious challenge to other government. Second question, if you allow me, the moderator.
One question.
To Dr. Oseji, the Permanent Secretary, Delta State Ministry of Environment. Madam, you have, from your presentation, you have a quite experience on the medical, given your background. And you have also told us the effort you've made in contributing to humanity. But my question is, could you initiate or advise government on the response time on issues of climate-related challenges? I could see the last challenges we have regarding the flood in Nigeria. I know the issue of response time has been a serious issue. Some victims have spent days, weeks without even getting response from even their immediate community. And if we talk of health, the response times is key to saving lives. So how could you tell us about the improvement on the response time?
Thank you very much. Number 3, thank you very much. Please, to the question, we have just 5 minutes to answer these questions.
Hi,
Thank you
my name is Nanine. I'm a medical doctor and researcher in South Africa. I'd like to thank everybody for what you shared today. It's very inspiring and great work. My question is to anyone on the panel that would like to answer, considering the title of the event is the health implications of mitigation strategies. We know that animal agriculture is one of the leading drivers of climate change. Where do you see the advocacy for adoption of plant-based, plant-rich diets and meat reduction diets in healthcare at the moment? To anyone.
Thank you very much. That's number 4. Okay. After that will be last. 1 minute, please.
Well, I am Rex Anigoro, activist Rex Anigoro. I am activist Rex Anigoro from Delta State. The Senior Special Assistant to the Governor of Delta State on Civic Engagement and Civil Society. So I can appreciate the fact of what you have said, engaging with the civil society. I am happy that you are doing this at the level of the Ministry of Health in Lagos. I want to find out, do you still also have this kind of level of engagement as a state government where the civil society is engaged at all levels for the good of the state? For example, in my state, that's what we have. We have a Delta State Civil Society community, which when I came into office, we helped to establish. And so it's easy for you to be able to engage at all levels, whether health, whether education. You just go and get the data and you say this civil society engages in this and that. Do we have that in Lagos for the purpose of
thank you very much.
Thank you.
Noted. Last questioner.
Thank you.
Close your mouth, please.
Thank you. My name is Haita Susan Wasubire.
Please close your mouth. Close your mouth very well. Yes. Speak louder.
I'm Haita Susan Wasubire, a climate change scientist with Climate Action Network Uganda. Mine is both a question and I would say a suggestion. Now this can mainly go to the Ministry of Health and Ministry of Environment. Now I noticed that in most of the deliberations and also the work that is being done, emphasis and focus is being put on the ecosystems, and very little focus is being put on ecosystem services. And these are the benefits that we enjoy. Now, my question is that what is the ministry, both the environment and the Ministry of Health, doing to ensure sustainable ecosystem services are being preserved and special focus is being put on them to ensure that we continue to enjoy these services decades to come? And then my advice is that in your advocacies, in your deliberations, please include the ecosystem services, because they are completely different from the ecosystems. The ecosystem services, to be sustainable, there must be special focus put on them. Thank you.
Thank you very much. We have 7 minutes to be out of this space, and I'm going to give each of our speakers 45 seconds each to address the questions so that we can conclude our program. So we're starting with Dr. Oseji. Thank you very much.
Okay, I wish we had a clock to be ticking. Climate change and financial protection. What we did in Delta State was that we provided health services that was free. Now, Delta State is one of the best states in universal health coverage in Nigeria. We have had a free maternal and free under 5 program since 2007-2010 respectively, and with the current administration in 2017 it went on to insurance. So we have about 1 million people that have been enrolled in the insurance scheme, and the strategy we implemented was that during the period of the residents in the IDP camps, they were introduced to the insurance scheme. Another question for me is the time lag. One of the things we fail to do in government and civil society is adoption of best practices, but you can't adopt if you don't document. So I believe that all of us who have participated in responding to the recent flood disaster, we should document what we have done, circulate it widely, and those who read it should adopt it, learn from our mistakes and improve on them. And then finally, from Uganda, a focus of ecosystems. That's quite interesting. Because I was in Ministry of Health, I knew about the traditional medicine board that ran our botanical garden. And when I went to Ministry of Environment and I asked them what they were doing for botanical gardens and things like that, they said there is nothing. And I said, what about the traditional medicine board? They said it doesn't exist. I said, that's because you don't know. So now go to the traditional medicine board, set up a collaboration so that we can do a lot more on the ecosystems. Thank you.
Professor.
Thank you. So the question around Governors Forum, yes. So I believe, you see, governance is a personal choice. You know, not everybody wants to govern with an open page or an open strategy. I believe it works for me because it works both ways. I get information and my policies are targeted in a very effective way. I take your point, and I believe that it can be introduced through the Governors Forum, and I will mention it at the next opportunity. The other question, civil society, yes, we have a special advisor for civil society like yourself, whose main function is to engage multiple high-level engagements in community. But I believe you need to break it down into each agency to be effective. And then the issue around protein, yeah, very important question. We are very interested in cellular protein, you know, which is steak or fish or whatever that is not animal product, you know, but is made through biological processes. I know South Africa is big with that. We also are trying to adopt that in Nigeria because we just have too many mouths to feed and not enough space to roam cattle or sheep or chickens or whatever. So I think a time is coming where, you know, we have to start thinking about developing protein that's not animal-based. Thanks.
Thank you very much. Thank you very much. Please, a warm round of applause for the speakers. Thank you very much. Thank you very much. I'm going to introduce the last speaker who is going to give us a vote of thanks for just 2 minutes, and then we're going to have a group photograph of all the speakers on board. So please join us and welcome Mr. Alabo James. Quickly, 2 minutes.
Thank you, Mr. Moderator. I'd like to thank our very special panelists. Now, first of all, I'll start from my left. I want to thank you, sir, Pastor Peter Moragbo, for your resilience on how you have been championing issues on climate change. I want to thank Dr. Mrs. Ofodele, the director in climate change in NIMASA, for telling us about the reduction, what the agency is doing on reduction on carbon in sulfur. And then Professor, sir, thank you. You also told us that for us to go forward by way of relieving the impact of climate change, we have to work with the civil society. And then Dr. Hoffling, good. Hoffling told us that we should train nurses to be in leadership role. And then our honorable, thank you, sir, Mr. Honorable Ghani, you told us that you've been doing health programs, free health programs like BP checks and all that. Thank you, sir. And our PAMSEC, we are glad to have you here. You also told us that we should advocate for better houses. We thank you all, and I want to thank the in-house audience. Thank you very much. Together, we are all champions. See you in COP 28. Let's do this again. Thank you very much.
Please, you're going to do something for me. Just one word, because we're going to have a group photograph. You just repeat after me. Together for implementation. Just at the count of 2, just say it. Together for implementation. 1, 2, go. Together for implementation. I can't hear you. Together for implementation. Thank you very much. So please, want to have a group photograph. Somebody to help Mr. Barry. Use this camera.